Once you get up, higher than 102, we start doing more damage than good. When we get up to 105, our cells really, especially in the nervous system, aren't functioning very well at all. So you can get patients who are really out of their mind, right? The delirium business. We get up above 110, now we're really risking death. So if somebody comes to the emergency room and they've got 110, that's when you start getting the ice baths or the alcohol baths out. You've just got to cool them down. You can't rely on medicine at that point. It's got to be cooled immediately. The 105s, okay, you can give them medicine typically. They're going to respond to that. Some places are a little quicker. I know at one of the hospitals I worked at when I was in college, they had cold baths already this time of year when it was flu season and all. But I don't see it as much nowadays. So there's lots of nice little detail on the separate stages of a fever and how that fever goes. So on 827, you see normal body fluctuations. 37, remember from our digestion lab, we put the water bath at 37 degrees Celsius. That's about body temperature. That's about 98 degrees Fahrenheit. And throughout the normal day, we're going a little up, a little down all the time. Right? Negative feedback. We're always adjusting our temperature a little bit. We're around that area, that 37 or 98 degrees Fahrenheit. When we get infected with something, macrophages chew it up, they release some pyrogens, that tells our hypothalamus to start increasing. So now you see, you start raising the temperature. That's what they refer to as onset. This stadium business is kind of interesting, is that we tend, at least with most disease processes, we tend to reach a plateau. Okay? It doesn't just keep going up and up and up and up forever. And that plateau is usually around this 39, so usually around about 100 or so, 101, something like that. Again, if we get up to that 105, people are out of it, and we've got a problem. We've got to do something about it. So I told you the other day, I like letting my kids have fevers for a while, but not when it goes over 102. Right? At 102, that's kind of where we're meant to be. For some reason, some disease processes, some pathogens, maybe cause those macrophages to release more pyrogens than is necessary. And so we keep going even higher. But this is the normal course of a fever. We're going to get up to around that 100, 102, bounce around for a little while. Hopefully that does the job. The infection is sort of cleared at some point, and so we start to come back down. Right? So that's it. Simple. I'm not worried about all these different names about defervescence and what was the first one? There's another fervescence in there somewhere. Anyway, I'm not worried about the specific names. I just wanted you to kind of see the numbers there. See that there is a pattern to this temperature business. Okay. And then we'll finish up for today on inflammation. Okay, a little more on inflammation. And the first thing I want to say on this particular slide is inflammation is always listed as a non-specific part of our immune system, but it is also almost always involved in specific. Okay, it's always a part of it. We use both. But the take-home message is you don't have to know who the invader is to have inflammation. But when you do know who the invader is, it might help to have inflammation as well. Okay, so inflammation will be seen in both, even though we consider it a part of our non-specific immune response. So, the textbook tells us this is a defensive response to tissue injury, whether it's physical injury or whether it's bacterial or viral. Either way, it's injury to some tissue. So we want to limit the spread of whatever has infected us or whatever is stuck in our skin or in our tissue. And we want to try to destroy it, get rid of it. Begin the repair process, all that fun stuff. A very important little suffix here. Anytime you see any medical term that ends in itis, itis means inflammation. So if your voice box, your larynx, is inflamed, we call it laryngitis. Right? If your pharynx, the back of your throat, is inflamed, we call it pharyngitis. So anything that has an itis on the end, you know right away, inflammation. Right? There's something wrong. We're trying to fight something. These are the 4 cardinal signs, we say. That's not up there just for the game tonight. That's how it's really referred to. The cardinal signs of inflammation. So redness, swelling, heat, and pain. Right? Those are kind of the big ones. These can be especially important. Knowing all 4 of these can be especially important when you start dealing with people of color. If you can't see redness in particular, it's a good idea to feel for heat. You know, you assume somebody came to you for pain, so that's an easy one. All right? But feel for heat. Feel for swelling. In most of us pasty white folks, it's pretty easy to see inflammation because we see redness right away. We don't have to go any further than that in many cases. But there are a lot of people out there who aren't as pasty white as us, for most of us. So there's the medical term for these. We've used the term edema a couple of times in this chapter. And then erythema we used back in the skin chapter, when we said a redness to the skin, a red tone to the skin. These are the 4 cardinal signs that some part of your body is undergoing inflammation, either due to trauma or infection. Right? So let's explain them. As we talked about the different players involved in the immune system, well, what we see is bradykinin. Bradykinin is what's usually responsible for the pain. We learned that when we did the pain section. So we said damaged tissues tend to release chemicals. One of those big chemicals was bradykinin that stimulated pain neurons, or what we call nociceptors. Also things like ATP and prostaglandins. There were a couple of other weird things there. But in this chapter they mentioned specifically bradykinin. So that's going to help elicit the pain response in inflammation. In histamine and heparin, where do they come from?
From the one of the cells.
One of the cells, one of those white blood cells.
Basophils.
Right? Which ones?
Basophils.
The basophils, right. The basophils. They were in very low number in the blood, but that's because they're all scattered out in the tissues. They're all over the place there.
But wouldn't, like a vasodilator and an anti-gluten, wouldn't that inhibit swelling?
No. A vasodilator would bring more blood to that area. So that's where we get the swelling. Then the anticoagulant keeps us from clotting on the inside there. So we want stuff to leak out. We want white blood cells to be able to climb out. If white blood cells have enough room to climb out, the plasma surely leaks out. So this actually promotes swelling. The swelling is really more of a byproduct. We're trying to get our white blood cells out there. Some people have kind of argued that, well, having the plasma in the area might help too. But I would say, well, only because you want what's in the plasma. If there's antibodies in there, if you want some oxygen in the area or something like that. But I think the plasma really is just a byproduct of what's going on there. So we know damaged cells, mast cells, basophils, lymphocytes, macrophages, platelets, all of these can actually help stimulate this immune response. The vasodilation, swelling of relaxation of the blood vessels, leads to what we call hyperemia, increase in blood to an area. That's it. That's kind of a simple one. So in many ways, these two terms are kind of complementary. They're almost the same thing, really. If you bring more blood to an area and you don't have a lot of pigment to the skin, then that area becomes red. What about the temperature of our blood? The blood is born inside of our body. It's flowing on the inside. It's not on the outside here. Right? So it's warm. So if you increase blood flow to an area, you are certainly going to make it red, you're going to make it swell, you're going to make it warm. And the damaged tissue will release the chemicals that cause pain. Plus the swelling causes pain. If you just put more swelling, more space in an area, whatever's in there gets pinched more. So those nerves, those pain nerves, will feel the pain. So really those first chemicals that we mentioned, the histamine and the heparin, are really what causes most of the inflammatory response. So vasodilation and vascular permeability. If you close off the clotting business, then it's a lot easier for stuff to get out of those capillaries. So really these two concepts, vasodilation and vascular permeability, can explain all 4 of the cardinal signs of inflammation. Yep.
But isn't inflammation good for
Yes.
recovery? So why would I want to take anti-inflammatories and ice baths and that, the whole rice?
Yeah, and that's a great question. And it kind of gets back to the same story with fever. Is a little is good, too much is bad. Right? And how do we want to treat people? Because the pain seems to be the big thing in our culture. Somebody's in pain, we want to take that away. And if you take away the inflammation, you will take away the pain. But you're right, inflammation is a positive thing. We want to bring those white blood cells in to look for foreign invaders. We want to bring in this fluid to help us with the repair of business. So yeah, are we extending it? It's something that I think a lot of people would probably like to look at sometime. But we always worry about the pain, so right away put ice on it. Limit the inflammation, whatever part of the body, and remember, you can't always see this, right? If you have damage inside somewhere to your stomach, you're not going to see that on the outside. You're not going to see redness, heat, and swelling. Okay? But the only thing you're probably going to see or hear from your patient is the pain part of it. Right? So this is mostly good for superficial stuff in terms of you guys going into nursing and PT. But certainly, interior body components have the same process happening. And if you opened up the body, you should be able to see redness, swelling, heat, and hear the patient complain. Okay? So, brief introduction there to the inflammation process. I'm going to end on this slide for now. It's the 829 here. This has got a nice broad overview of what might happen. What we just talked about here. In this case, they're showing a splinter in the skin. Great. Okay? But it really could be bacteria somehow got through the skin, or a virus somehow got through. Either way, you're going to hurt some cells somehow. So we see some damaged tissue, and this particular splinter is carrying bacteria with it. So it's double duty. It's not just the trauma, but now we've got a pathogen included with that trauma. So we're going to certainly damage the cells all along this path, right? And so these cells can release certain chemicals. There's the inflammatory chemicals again. The bradykinin, whatever's in the area, basophils can release the histamine, can release the heparin. So what you see is these chemicals are going to act, and as the chemicals are released, it sort of makes sense, doesn't it? That the chemical concentration would be greatest right around the problem. Right? If you release a whole bunch of chemicals, you get the highest concentration here. As you get a little further away, the chemicals are starting to spread out more, right? So there is a concentration gradient of these chemicals after a short period of time. So way down here, there's very little of those inflammatory chemicals, but up here there's more, and more, and more. That concept of this concentration gradient is important because that's how many of these white blood cells find their way to the problem. They go against the gradient. Is these cells sense those chemicals and they look for more of the chemical. So they're released from the blood. We've already released histamine and heparin. So the blood flow, if we saw the artery out here, the artery is bigger to let more blood come in here. Then we've got the heparin in there to keep it from clotting. So now we've got increased permeability and we've got increased blood flow in the area. The red cells don't care. They don't move, right? They just flow. Okay, so they keep flowing on past, but the white blood cells sense the chemicals and start to squeeze out between the cells. So what you usually see is the blood flow sort of slows in this area because there's so much in there. The white blood cells climb to the edges of the blood vessel. Okay, so we call that margination. They go out to the margin. Then once they feel the walls of the blood vessel, they climb through. That's called diapedesis. Where is that?
Bottom right.
There we go. Diapedesis, where it's squeezing on out. Okay? And then once it's out, it goes by the concentration gradient. That's what we call chemotaxis. It's feeling its way by the concentration of the chemicals that have been released by the hurt tissue. It's going to climb its way up there, and then once it gets there, it does what it's supposed to do. Right? So it's going to try to chew up the foreign invader, or if we recognize it as a host cell, it'll try to kill the host cell. We may wall off the area and make a killing field. There's all sorts of nice options there once we've at least directed the white blood cells to go to the damaged area. But we're going to have inflammation in this whole area because of those chemicals that were initially released.
Do we need to know all those terms, like margination, diabetes?
I think so.
Okay.
I think those are pretty good. I just talked about them, and they make sense, don't they?
Yeah, I was just
They
wondering.
kind of make sense. So chemicals are released. Blood flow increases to the area. The vessels get leakier. Red blood cells don't know what to do. They just keep flowing, but white blood cells do. They go to the edge of the vessel. That's marginating. Then they feel for the open areas. They diapedese out. Then by chemotaxis, they climb towards the problem, and then they deal with it. Hopefully chew something up. And this is hopefully what's happening in pretty much all cases of inflammation. All right? So that's going to be my quitting point for today, so that I can knock on this specific stuff next week. Enjoy your weekend. Get some rest. Study tonight about 10 p.m. to midnight. It'll be a great time to study really hard.